Hi, everybody. Welcome back to the 2020 Worldwide Women's Security Virtual Summit. My next guest, Courtney Abonte. She's with Teneo.com. That's Teneo Risk Advisory. Ms. Courtney, welcome to the show.
Thank you for having me.
Boy, we're going to have a really interesting conversation today. Ever since COVID hit, security personnel have been sitting around saying, what's next? What am I going to do? This is a whole new model. And so your discussion today is going to be about leading a business during coronavirus. This is not our grandfather's security business. This is a whole different thing, and it has all kinds of layers to it. So let's talk about that. Let's talk about the COVID-19 trajectory for business and society. We've got this thing called COVID. We said, well, that's like the flu. Well, it's not like the flu. Wait a minute. And the trajectory kind of goes downward, doesn't it, from there? Outbreaks and company outbreaks, people staying home or online. Are we on the upward curve to recovery, or are we still kind of stuck in this crisis mode?
I think we're still, unfortunately, stuck in this crisis mode. And the reason I say that, and I think everybody, if you just take what you see on the evening news, there is a lot of concern and a lot of talk about a real second wave in the fall when we collide with flu season. And, we still haven't reopened schools, and there's a lot of concern, as everyone knows, that reopening schools will create a further problem all at the same time while we're, hitting flu season. And we're in the midst of trying to find a vaccine that will help eradicate this, hopefully. But I just don't think it's going to happen fast enough to manage those potential risks in the fall. So I don't think we're out of the crisis yet. I don't think we're in the clear. And I think everything else happening this fall with election season and all that is really going to, kind of unfortunately keep this crisis going a little bit longer. And, we're still seeing the economy faltering in the midst of all of this. We've got so many competing factors, kind of pushing this crisis along and keeping us in a crisis state, I think. And that's my opinion. And, based on the discussions I have with clients, I think they're all bracing for what happens in the fall.
Well, I agree with you. In fact, I'm going to go one step further. I don't think this is the crisis, right? This is a crisis, but now we have to think about forecasting people being out of work, people losing their houses, not being able to pay rent, and the flu season coming up. I think we're going to have a trifecta here. So what's our response initially to this? When this hit, what did security companies do to kind of start approaching it? Was it wait and see every day, or do we try to make some plans for this?
Well, in the line of work that I have, I run our security advisory, risk advisory business within my company, Teneo. And we really focus on physical and cybersecurity risk management and advisory for our clients. Fortunately for us, we have two pandemic and infectious disease experts, public health experts in my team. So unlike probably a lot of other companies who do this type of advisory, we were very well positioned and very well prepared to help respond and help our clients respond. So the immediate kind of outbreak or the days in the U.S. where we were really starting to realize that something bad was about to happen in, let's call it, the mid to late February timeframe. Our clients were coming to us saying, and even the heads of security within these clients and heads of HR who realized they were responsible or needed to be responsible for health security, they were coming to us and saying, what do we do? And the first thing that we tried to lay out for our clients was the fact that this thing was going to progress in a certain way. And we're going to see, infections within companies. We're going to see infections within communities, and then we would probably see mass outbreak type scenarios. And so let's help you plan for that. And that is what we spent those initial days doing, scenario planning and helping clients understand what the impact would be to their business operations and, their employees, and how to manage through that if each one of those stages occurred, the business infection, community infection, mass outbreak. The interesting thing is we were preparing for a potentially multi-month time horizon for all that to occur. And it happened in 1 week. In the U.S., it happened in 1 week. And so everything that we had planned for in the advisory we had set out to deliver to our clients became old news within 7 business days. So, that was how we helped our clients start the process. And then dot, 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 it all changed quickly.
Right. And so by March, and I recall, my business was traveling. I go to conventions, do shows, and all of a sudden nobody's traveling. I had to flip my business model.
Mm-hmm.
But since I'm my own person and, self-contained, it didn't impact me. What I saw among my friends was a high level of stress and anxiety started to increase. Anxiety of the unknown, but also the isolation part of it. Here we have people isolated, working at home, away from their business, but also inside the house with their family, both more full time, right? The balance is gone between things. How did anybody anticipate that part of it? I find that part very surprising.
Well, again, I think stupidly back in March, but we didn't know any better. I think we thought that this lockdown period was going to take 2 weeks and we would get through that 14-day isolation or 14-day, shelter in place timeline, and then we'd be fine. But that turned out to be absolutely not the case. I'm still at home working full time, not in an office, and it's almost September. So, the next thing that we saw happen, and, the way, in response to your questions, I think it's interesting to note that we, I hate to say this, but to some degree, we're kind of figuring out day by day what was going to matter for clients and what was going to resonate with business and resonate with heads of security based on our own experiences and what we were going through. And that 2-week period came and went. And then it was 3 weeks, and then it was a month. And we really started to hear from our clients and, especially like heads of security, heads of HR, that this anxiety was starting to settle in and leading and working in a period of extended lockdown and uncertainty was likely going to start to chip away at productivity and, kind of the mental stability of employees who were, now at home with kids and maybe parents and trying to hold down a full-time job while homeschooling and dealing, as a caregiver. It all became a lot very quickly. So, we started to help our clients understand what some of the options were and how to manage that, as a business by doing some things differently and making the transition to a full-time work from home situation easier through tools and technology, by providing breaks, by connecting with employees in different ways. And as we were providing this kind of counsel, we were practicing it on ourselves and, testing out our advice on our own teams and our own people real time.
So how much do you think that the stress, the anxiety, the uncertainty, how much has that affected leaders' ability to make decisions? And I know that sounds kind of like a impossible question or an easy question, but I don't mean it to be. In other words, we know that this stuff is not sustainable over a long period of time. We can't all stay home forever. That's not going to work. We can't rush out and start licking shopping carts and getting infected. We can't do that. But I seem like we're missing the middle ground here. Does that make sense? How do we get back to leadership decision making that benefits and balances the health and profitability of your business? Because I got to tell you, without the business, we don't have our health, really.
Yeah, and in addition to having these pandemic experts in our team, we also had an advisor, a senior advisor, who is a leadership. He's a trained psychoanalyst and psychotherapist, and he focuses on counseling leadership teams and CEOs and boards of Fortune 500 companies. And the thing that was most important in his mind, in terms of the counsel he was giving his leadership clients, his CEO and board clients, was authenticity and transparency. And, it was okay to admit we didn't have all the answers and we weren't exactly sure what the future would entail. But, that communication, that authenticity, and that ability to try to remain, calm and not try to show that you have all the answers, but really listening and engaging with your people in new and different ways to understand what it was they were going through and what was important to them, so that the leadership team and the CEO of a company could figure out how, the head of HR, to figure out how do we be more understanding in this completely unusual and unprecedented time, and how do we provide the right level of services to our employees to try to keep this business going. And again, I'll just go back to, the best advice and the best counsel we heard our experts giving their clients was be authentic. Don't try to have all the answers. It's okay to say, I don't exactly know what the future holds, but we're going to work through this together, and we need to communicate and stay in contact with you, and frankly make some allowances for this new way of working and the new lifestyle that everybody was going through at the time, and still continues to go through. And the last thing I'll say is, we saw a rise in requests from our clients wanting to understand, are there certain tools out there or services that we can be providing to our employees related to mental health, giving them breaks? Are there different things that we should be doing from a work from home and from a benefits perspective that could try to help mitigate against this really, unusual scenario of working? And even our own company, we received a few new benefits in the form of access to tools or access to services that really helped, or offered to help from a mental health and just a kind of overall sense of well-being perspective.
Well, I think you hit it right on the head there with transparency. That's really the key to excellent leadership. Speaking of costs, what's the new risk cost benefit analysis? It's got to be a completely different model than we're used to. And, frankly, I can't figure it out myself. And I interview hundreds and hundreds of people every month, and I'm scratching my head saying, I'm not sure what it is.
Well, this is the topic du jour actually right now with my team. And as we start to think about, the next phase in this whole pandemic, the cost benefit analysis right now is the cost of reopening versus the benefit to reopening, or the cost of continuing to run the business in the face of potential litigation. And unfortunately, I know that's coming down the pike. We're seeing a few instances of it already, but the potential costs of reopening too soon, and having a resurgence in infection in your workforce or customers, and having to deal with the fallout of that. And what we, even during let's call it the April, May, June timeframe, when reopening, started to be the buzzword, like we have to figure it out, we have to figure out how to do it. We had long conversations with our clients about examining the trajectory of things like antibody testing and the development of vaccines, and the use and the expenditure on things like PPE and testing and temperature checks and all of that as part of a reopening process. Was it going to be worth it to reopen as soon as, public health guidelines said that you could, in the face of substantial investment in order to do so? Was the need to reopen just reopen for the sake of reopening so we can get, back to work again? Or were there some real cautious steps that needed to be taken, and some real, hard financial analysis about, what are the risks if we do this too quickly, and how much are we going to have to spend in order to make that happen? And, for companies like mine, which is a professional services firm, and others like us and financial institutions who largely have been very successful working from home, we've been able to we've had the luxury of just holding back and keep on keeping on with working from home, and we haven't necessarily had to dump a bunch of money into the reopening procedures. But other companies and other businesses in the essential services or in other types of businesses need to move quickly or wanted to move quickly. And those cost benefit questions, came fast and furious in April and May.
So how do we build resilience before returning to operations? It's a new resilience, and right at the top of my head, what I'm thinking is working from home was resilience. The ability and the quickness that everybody flipped from office to home is kind of remarkable. Mm-hmm. Think about it. Everybody's on the internet at the same time, and guess what? It pretty much worked. So now, what is that new resilience that we look at before we get back in the office? Or you know what? Maybe we don't go back to the office because this business model works better. It's possible for some businesses.
Yeah, maybe we don't. And again, for some companies, like I said, in the consulting or professional services sector, this might be it for the foreseeable future until there's a vaccine. All to be determined. But the other companies who need to reopen or want to reopen in the sectors where, let's call it the airlines or, the travel and hospitality sector, where eventually, they want to reopen. There is demand to some degree for flights, for hotel services. They need to do this. They need to open, but they need to do so in a way with the right risk mitigations in place. And also, it demands, I think, a hard look at business continuity plans. What happens if we have to do this all over again in the fall? Are we prepared to do that? And also, this pandemic, I think, has caught everybody off guard and made everyone realize that health security now is going to be just as important to business continuity planning and risk management as physical and cybersecurity. And, I think we're going to see a rise in health security risk monitoring, and companies will start to consider and or invest in monitoring for future pandemics. And there are some businesses out there that do this and that offer this type of data analysis and this type of monitoring. But I think as part of future business continuity planning and business resilience planning, it will now incorporate health security as the other leg of a three-legged stool now with physical and cybersecurity. And that's something that, we're starting to pick apart and starting to, build our thought leadership and services around, even in my own company and in my team, as we start to think about what does the future hold and what will the demands on a chief security officer or a chief human resources officer or a chief risk officer look like now that we've been so informed by the risk and the fallout from a pandemic.
Well, it makes a lot of sense. I worked in the public health sector in law enforcement and security back in the day. And I worked at UCLA Medical Center, right? I mean, talk about, 35 miles of hallways, medical facilities and security for those things, a whole nother ball game. And I find it interesting that vertical market, I think, is going to move to the forefront of the security industry. I really see that coming. And we need a whole different set of skills for that, for sure.
That's correct. And I think a lot of companies are saying, again, a consulting company or, a retailer, they're not in the business of medicine. And now suddenly, they're put into these positions where they have to decide, do we do temperature checks? Do we make our employees get tested for COVID-19 or for antibody testing? Do we, how do we do that? And for companies that aren't traditionally in the medical field, these are hard questions. And do we outsource that? But if we outsource it, how do we control it from a data privacy perspective? So I think you're right. Health security comes with a lot of additional subject matter expertise and subject matter requirements in order to pull it off in the right way. And I think, most businesses are still trying to figure out how do we integrate health security when, we are not in the profession, in the medical profession. And how do we do it? We do it credibly and, keeping our employees and our customers safe.
So your business, in essence, is a think tank. You have the brightest people in a business like yours, a lot of experience, innovation, creativity, thought process, thought leadership. And here is what I'm concerned about now. People in your position receive information, but nowadays, what is real information? What is factual? What is opinion-based? It's all a big blur. And I think it's much more difficult to vet facts. And we need facts to make decisions in our line of work, right? How are we addressing that? Where do we go if we started? I still keep my grandmother's 1936 encyclopedias. I kid you not, just to go back and check on some old things to make sure that I remember what I'm talking about. Because now you find out that what you thought happened didn't happen in some circles. Where are we going with the analysis part on all this?
So, it's an interesting question. I'm glad you asked that, because one of the biggest points of frustration for our clients and for, us in delivery of services to our clients was parsing through all of the information out there, whether it was from universities or think tanks or politicians or public health experts or Twitter and rumor and innuendo. How do you make sense of it all? How do you choose what is the right gold source of information to listen to and to focus on. And, as part of understanding what the implications were in terms of the trajectory of the virus in a business, in a community, in a state, in a city, I think our clients, we saw, and us as well, in the early days, were really struggling to figure out how to track that information on a more real-time basis and make sense of it, using data versus just, for example, relying on public health guidelines, because they were so broad and so general to some degree, and every state had its own kind of plan in terms of public health guidance, and even at the state and local level within various, or municipal and local level within various states, you saw differing guidelines or differing opinions about when to reopen. Was the virus getting better or worse? And our team, and particularly a couple of our data analysts, they started consuming data from any source that they could, that states were capturing, that countries were capturing, and running the analytics on the information to really make fact-based and data-driven decisions about reopening. And I guess this is my way of saying that we continue to see information emerge from all types of sources, and really trying to use that, or opinion, or articles or political statements, in decision-making process about whether or not to reopen. We tell our clients, let's just cut through all that noise and let's look and see what the data tells us. And over time, data analytics has really been the foundation for how we've worked with clients to make those decisions about reopening. You can't argue the facts. And if you look at 14-day, 7-day moving average calculations about whether or not a virus is picking up or trending better, that is really powerful information to make a decision about the safety and security of your people and your customers to reopen, versus just being told by public health officials that you can, if you want to, or you can when you're ready.
$64,000 question. Let's talk about the future of work. Here's where I take all this data, and there's tons of it, terabytes of it, information floating around our heads, and it boils down to this: social distancing. That's an oxymoron. I think that's the crux of what's going on here.
Yeah.
We have a lot of conflicts in this data and responses that conflict with each other, but have to be done in parallel. And I think this is what confuses people. But let's talk about what some future things might look like. Things like access control health passports, personal mobile health surveys, contact tracing, and those things now start tipping into, hold on a minute, I don't want my personal information disclosed. There's HIPAA things going on here. I think this is one of the greatest challenges in human history. And I'm not exaggerating when I say that. There are so many moving parts to this. If we don't get this right, we're going to have a bigger problem in the future.
Yes. And I think when we talk about potentially what is the future of work look like, we spent a lot of time over the last several months just looking at our colleagues over in Asia and in Europe, and trying to learn from their experiences and how quickly or not so quickly they were able to go back to the office, and what human behaviors were looking like. And were citizens abiding by public health guidelines? Were they wearing their masks? Were they socially distancing and washing their hands? Were they even incentivized in that kind of environment to go back to work? And I think largely the world will look like this on your way back in. I think a lot more people are going to walk and ride bikes or drive themselves in, or work from home if they have that option. And we're seeing companies are already starting to invest in new and unique ways to get their people to work by giving them bike passes, or giving them a little bonus to, invest in a bike or something along those lines. But I think, gone for right now are the days of, taking the subway. Or taking the bus to work with a jammed packed bus in the morning and in the afternoon during rush hour. So even the way that we go to work is going to be a little bit different. And then when we get to the front door of the office or the manufacturing facility or the retail location or wherever it is that we work, now you're getting your temperature checked. And it feels a little weird and invasive. And I think at some point we'll all just be kind of used to it if, in fact, a location or a business chooses to do that. The other interesting thing will be, if we'll have mandated COVID-19 testing as people cycle back in to an office environment. And, there are two schools of thought on that right now. One, yeah, let's do it because we should, offer that as a benefit or as an opportunity for, employees to feel better and safer about coming back. But the test results are not necessarily pointing to the level of accuracy to even make it worthwhile. So that is an interesting thing that we'll see play out. And also, who's going to manage that information and where is it kept, and how do we ensure privacy of individuals when they do decide to come back in? And that's just the journey to get to the front door of where you're going back to work. Then once you're in, the whole reduced capacity and staff rotations and A team, B team type of things that we're hearing about, plus limiting the number of people in elevators and on escalators and what you can and can't touch, and wearing a mask all day long in an office environment or in a working environment. All of these things are pointing to a completely different way or style of working. And, from what we've heard from our colleagues around the world, there's people want to go back because they want that sense of routine again, and they want to be back in an environment where they're engaging with other people. Yet the environment and what you have to go through in order to get there is so much less pleasant than it used to be. And we've heard people say it's not fun sitting at your desk and wearing a mask all day. It just feels very sterile. And when you're staff rotation or an ATB team type of environment, you're not necessarily even in the office with the people that you typically engage with. So I think in the near term, the future of work is going to feel very clinical, less social and more distanced. And, probably we will find that it was more desirable to be at home when you could work a lot more efficiently and you'd have the people that you need right at your fingertips. So I think, again, as I said earlier, TBD here, but the future of work, I think we all agree, is forever changed.
Courtney Abonte, she's the president of Teneo Risk Advisory. That's Teneo.com. We've been talking about COVID-19. Are we in the crisis? Is the crisis emerging? Where do we stand? Excellent information, Courtney. And I feel if somebody contacted you, they would be in very, very good hands. Thank you so much for coming on the 2020 Worldwide Women's Security Summit. And we hope to hear more from you in the future.
Thank you. I appreciate you having me.